Hi, welcome to Naptime Nutrition. I'm Yaffi Lvova, registered dietitian, nutritionist, and owner of Baby Bloom Nutrition. And today I'm very excited to be talking about PCOS. And I have a wonderful guest with me, the fabulous, the hormone dietitian, the avocado herself, Melissa Groves Azzaro. Thank you so much for joining me.
Thank you. Thank you so much for having me. I'm really glad we were able to work this out.
Yes, yeah, we did have a bit of a technical hiccup getting online. This whole lockdown thing has really altered internet usage. But while I have worked with PCOS before and have my own history, I wanted to bring on an expert to talk about this specifically because it is such an issue and it comes up so often. So I really wanted to nail it from all angles. And that's why Melissa is here helping me to convey some really important information to you who might be dealing with PCOS. So, okay, so you're the hormone dietitian and you talk a lot on Instagram, you're doing lives, you have even a PCOS program online. So how did you get into this specifically?
So kind of interesting. My first job as a dietitian was working in the office of a functional medicine dietitian. So I, sort of had that experience right from the start. And she really liked working on the gut patients. So I would get all of the weight loss patients, everyone who came in and said they wanted to lose weight. So from a functional medicine perspective, weight is actually a symptom of something underlying that's going on. So when we would do that deeper digging, we would almost always find some sort of hormone imbalance, whether it was high cortisol or high insulin or low thyroid or a condition like PCOS that was like, I would look at what these women especially were eating and just be like, look at how much they were exercising and like something doesn't add up here. Like, why are they doing everything right and the weight is not budging? And, you really can't lose weight unless all those hormones are balanced. So that was where I really got interested in women's health and, specializing in women, particularly as it relates to hormone imbalances. So when I opened my practice, I really wanted to make that my focus.
Wow. And it's great that you bring that up. So we both have histories in trying to help people lose weight, but that is not where we are now as professionals. And anyone who's watching this segment, if you have some sensitivity around the subject, there may be some triggers. We are going to be talking about weight and how PCOS might impact your weight and traditional advice from doctors. And we're going to be discussing these topics, but neither of us as dietitians are on the weight loss wagon. We're both non-diet dietitians who see, as you mentioned, Melissa, who see weight as a symptom rather than as a problem itself. And that's what really separates this angle from traditional dietetics and traditional nutrition that says if you change what you eat and you change how you move, you will lose weight. It is an oversimplification. It has dangerous consequences. And I just want to give that disclaimer that neither of us is coming from that angle at this time in our professions.
Yeah, absolutely. I mean, for sure, there's all those studies out there that's like, oh, a 5% reduction in weight in PCOS improves symptoms or improves testosterone levels or things like that. But I'm looking at these studies with the eye like, well, was it the weight loss itself that resulted in those changes, or was it the change in the behaviors and doing things like adding more fruits and vegetables to your diet that actually resulted in those hormonal changes and marker changes for things like heart disease and diabetes? I don't think there's a magical number. I mean, I think that can be an impression that you get, especially once you're, down the road of working with like a fertility specialist, where it's like, oh, you have to lose weight to get pregnant. And it's like, no, you really, really don't. It's those healthy behaviors you can add that make the difference.
Right. Yeah, and I see that in other areas as well. And it's not saying that you shouldn't pursue healthy habits. You're saying the opposite. You should pursue healthy habits. It may or may not result in a change on the scale, but it will result in a shift in your hormones. It will result in different biomarkers of disease, things that we see in the blood, your micronutrient levels, and your possibly your lipid profile, and your inflammation markers, your blood glucose control. All of those things can be shifted in a favorable direction while the scale doesn't necessarily shift. And so it's really
Mm-hmm.
important to understand that and to say there are objective measures to health, and the scale is not one of them.
Absolutely. I love when I'm working with someone who's gotten that answer from the fertility clinic, who's like, well, come back and see us after your BMI is, under 40. And we work on all those other things, and they get pregnant, and then they get to call the clinic and say, I don't actually need you. It's like the best feeling ever. Yeah.
It must be so satisfying to just get someone pregnant.
Yeah. Yeah. And it's like, haha, my BMI is still 42, or what, like it has nothing to, like I was saying before, there's no magical number at which you're going to become pregnant, or it's going to become easier for you to be pregnant.
Right. Yeah. So let's get into PCOS specifically. What is PCOS?
Yeah, it's actually really complicated. The name is not super representative of what it is. Polycystic ovary syndrome. And, that is one of the diagnostic criteria, but you don't have to have cysts on your ovaries in order to be diagnosed with PCOS. Additionally, like when we think of ovarian cysts, we think of like the painful ones that rupture and that kind of thing. And that's actually not what's going on in PCOS at all. What's happening is it's a buildup of immature follicles, because your body's always kind of trying to ovulate, but never quite getting there. So to be diagnosed with PCOS, there's 3 criteria, and you have to have 2 of the 3. So the polycystic ovaries are one. The irregular or absent periods or ovulation is another. And then the third one is high androgens, which either can be defined by the laboratory values themselves or by androgen type symptoms like acne and facial hair and hair loss and things like that. So you can sort of fall into different combinations of those 3 criteria, but it actually affects more than just the sex hormones in the body. It really affects, pretty much every system in the body, from cardiovascular to, reproductive, of course, higher risks for diabetes and heart disease, and even certain types of cancers.
Very interesting. Yeah. Okay. So can't read. I'm broadcasting from my child's room because my workspace has been co-opted by lockdown. So how does it affect women who just in any stage? Because we briefly mentioned trying to conceive, and we'll get back to that, but it is important to look at it through different life stages.
Yeah. So, first of all, it's the biggest risk factor for infertility. And the reason for that is because you're not ovulating regularly. So you can only get pregnant when you ovulate. So if you're only ovulating, a couple times a year, that's going to lower your chances. So I do find, especially, the clients that I work with, that's where most of them are diagnosed. Where they've been maybe trying for a year and things aren't really happening, and then they go to the doctor, and that's where they get that diagnosis. Maybe they were on the pill for years and years, so they were having those like regular bleeds, so they thought everything was okay, and then all of a sudden, they get this diagnosis. I do see a lot more now of women getting diagnosed earlier in their teenage years. I have quite a few clients who are in high school or college, and have sort of just received this diagnosis. The reason why it's important to know that you have the diagnosis and to take steps to treat it is because of those long-term risk factors. So, much, much higher risk for heart disease, stroke. Over half of women with PCOS will have type 2 diabetes by the age of 40, which I think is just really, significant. And I think, there becomes this thinking that it's really just a reproductive disease. And once you have a baby, whether through, assisted, medications or, procedures to get pregnant, that it's just kind of over and it's fine. And it doesn't matter if your periods aren't regular or not, but there really are these sort of lifelong implications that you need to be conscious of.
So people who are experiencing this should really try to go for symptom management, whether they're actively trying to conceive or don't plan to have children at all.
Absolutely. And I would say, there's probably an equal split with the women that I work with, those who are in that like actively trying to get pregnant stage, and then those who are maybe on the younger side or have already decided, I'm just not having children is not in my game plan, but they want to take care of their own health and prevent some of these long-term risk factors from happening.
That's very interesting, because I'm not sure that information is really getting out to the public in an efficient way right now.
Yeah, and I think, on the other end of that spectrum too, it's important to note that PCOS does not end with menopause. So, I think cycles are one of the more visible signs that something's going right or not going right. But when those cease naturally as we age, the other parts of PCOS continue on. That's really where those like endometrial cancers start popping up, and the full-blown diabetes and things like that start popping up later in age. So yeah, the earlier you can get working on it and get that diagnosis so that you know what you're dealing with, the better.
So if anyone is experiencing the symptoms that we mentioned, which were irregular periods, which, as you mentioned, may or may not be obvious because of birth control usage, and there's also cramping associated. Yes, no? Okay.
No, actually, that's kind of a big misperception that painful periods are not a sign of PCOS.
Interesting.
Yeah. So what can happen? Because think about it. If you've gone 60 days or 90 days since your last period, there's a lot more lining built up than there would be for someone who was having 28-day cycles. So there can be, heavier bleeding and maybe heavier cramping associated with that. But the painful periods themselves are not a sign of PCOS. It's usually something else going on with our estrogen, and you can have both. So
that is very interesting. That's useful
mm-hmm.
information, because even as professionals, we are told that painful periods is definitely associated with PCOS. So you're saying it's more about the length of the cycle and the distance between cycles, as opposed to directly correlated with PCOS.
The syndrome itself. Yeah. So the more typical symptoms I see are the long periods, usually in the 60, 90-day range. Acne that is present, sort of all month long. I tend to see the pattern that's like, the beard area acne, as opposed to like what I get, which is like the PMS, like, oh, this month it's here, this month it's here.
Right.
Like that's
or the
T-zone
like, area.
Yeah, which can be more like oily, or not washing your face properly after your exercising, things like that. But yeah, it's really there. The facial hair, like excessive facial hair and body hair. There's the condition called acanthosis nigricans, which is like a black ring around your neck, usually, and like armpits. And that's really, a sign that there's some of that insulin resistance going on for you. Male pattern hair loss, like temples and top of the scalp. And that's pretty much like belly, tendency to hold weight in the belly.
Right.
difficulty losing weight, that like if you have that experience where you're like, oh, I did all the things and I gained a pound, you know, that can be something. But, you know, really the diagnostic criteria are the three things I mentioned before.
Okay, it's very interesting. Okay, so the traditional, as we mentioned a little bit earlier, the traditional advice from doctors is to go on birth control, which regulates the period. But of course, if someone's trying to conceive, that's not a logical option. And the other is weight loss. So how do you react to that? What do you do with your practice when someone comes wanting to get off birth control?
Yeah, so it's kind of funny. The international expert guidelines were released in, I believe it was summer of 2018. It was the first time there was like a consensus statement. And yeah, first line treatment for PCOS is birth control, metformin, and then come back for fertility meds when you're ready to get pregnant. They do mention diet as potentially helpful. And yeah, the doctors really have that in their head, like, oh, if you lose 5% or 10% of your weight, that's going to improve your numbers. You know, what I tell my clients is we don't look at the scale at all. I prefer you to throw it away because it's really not a good indication. And what we work on instead is those underlying root causes of the symptoms. So the biggest ones are insulin resistance. That's where your body doesn't use insulin as well, so that your glucose doesn't actually get into your cells. So it doesn't matter like how much you eat, your cells are literally starving while your blood sugar continues to go up. So that's one of the things that leads to those like really insane carb and sugar cravings when you do have PCOS, because literally your cells are starving and they're screaming for carbs, basically. We work on inflammation, which, back to the insulin resistance, 75% of women with lean PCOS have insulin resistance, and 95% of women who are, you know, overweight according to BMI have that insulin resistance piece. So, you know, balancing blood sugar is always like utmost important with the people I work with. Inflammation is another piece that's really common to PCOS. And again, that's one of those things that is worsened by weight, because that can actually make inflammatory cytokines. So it ends up being this like vicious cycle where you're making more inflammation and then you can't.
Oh, we lost Melissa. All right. Well, I'm sure she's going to sign right back in. And in the meantime, I'll wait for her, and I'll tell you that while doctors do advise losing weight, the condition itself actually prevents you from losing weight. And that can be really challenging when you're trying to follow your doctor's advice, and you're increasing your exercise, and you're looking at what you're putting in your mouth. And sometimes you can even get really anxious about that. That causes a lot of anxiety, and I'll get back to that. But your condition itself actually doesn't permit you to lose the weight that your doctor is telling you to lose. When you become anxious about the food that you're taking in, and you're looking at all of your different angles, and you're really focusing a lot on that anxiety can drive up hormones that cause you to be more anxious and actually to retain weight, cortisol being one of them.
Yeah, so actually that's a really good segue, because I was talking about the root causes of the symptoms of PCOS. So we've got insulin resistance and inflammation, and then the third main category is those hormone imbalances. And when I'm talking hormone imbalances, I'm not just talking sex hormones like estrogen, progesterone, testosterone. I'm actually talking about the adrenal hormones as well, which are cortisol and DHEA. And I really do see differences in terms of where those symptoms are coming from, even across patients with PCOS. For some of them, it really is like the testosterone is the androgen that comes from your ovaries. DHEA is an androgen that comes from your adrenals. So yes, your stress could be contributing to your PCOS symptoms. And, you know, that's another reason why I don't recommend restrictive diets, especially to women of reproductive age years, because it contributes to that higher cortisol and higher DHEA when you are not eating enough calories, when you're not eating enough carbohydrates, you know, when your body perceives a threat. And that's the difference, you know, like your body doesn't know the difference between actual imminent life-threatening danger or, you know, the fact that you are purposefully cutting back on carbs. And it just results in the stress, which makes your symptoms worse. So it kind of backfires. I get a lot of patients who, you know, were trying to follow, say, like a keto diet for a while. And it's like, oh, it worked for a little while and they lost weight. I mean, most of it's water weight in the beginning with the keto diet. But then it actually like reaches that point where it just backfires and the cortisol takes over. And it's like, I actually put on belly fat, you know, following this diet, which is, I'm sure, not your intent when you're trying to do a weight loss diet like that. So, yeah, so it's really kind of interesting. It's really complicated, and that's one of the reasons why I really enjoy working with this population so much, because everyone's different. Like for one person, it might be you actually have to eat more carbs, and for another person, it might be, you know, spending more time in nature and, you know, going gentler on exercise than what they've been doing. So yeah, everyone's different.
And that's an interesting point you bring up about going gentle with exercise, because a lot of times we see in the community of people who are doing a lot of exercise in the sports community, but also in people who are just exercising excessively, that it throws off their cycles.
Mm-hmm.
And what we were talking about before the broadcast is how that can impact someone with PCOS and how it might be hidden by the symptoms that they're already experiencing.
Yeah, so you know, what we were talking about is something called hypothalamic amenorrhea, and it's exactly that, when your body is undernourished or overexercised or overstressed. You know, evolutionarily speaking, it's not a great time for us to reproduce. I can't remember what the statistic is. I think it's something like 70,000 calories it takes to grow a baby. So if your body starts to perceive that, oh, it might not be a good time to reproduce, it kind of like ramps down production of those sex hormones. So what I have seen, you know, in certain cases in PCOS is there's such a drive to restrict calories, restrict carbs, over exercise, that there's actually kind of both going on at once. There's the underlying PCOS, but they're in a current hypothalamic amenorrhea kind of state.
And they might not even notice, and the doctor might not even notice, because they came in with an interrupted cycle because of the PCOS. So any further unfortunate patterns in their cycle might not even be noticed.
And generally, I mean, unfortunately, the kinds of things I hear back from patients are like, well, the doctor just said cut more calories or exercise more, without doing that investigation of what's actually going on right now. Yeah.
Right. And that's really why it's so important to speak to someone who's educated in PCOS nutrition and bring them on as part of your team when dealing with this. And also to see someone one-on-one, because there's a whole lot of information online, but Dr. Google does not have your medical chart and does not have access to your lab values and your lifestyle factors. So even the best doctor online is not going to be able to give you appropriate advice. And even the best dietitian, when speaking in this kind of format, is not able to advise you and your body, because it really does need to be based on your circumstances, biological and otherwise.
It's so funny. It's probably the most common thing I say on my Instagram account is, you know, if someone asks me like, well, what supplements should I take for acne? It's like, I don't know. I don't know you. Like, I don't know what the root cause of your acne is. I don't know what your diet looks like. I don't know what your lifestyle is like. You cannot give those personalized recommendations without having done a full assessment. And I think, that's really where you can kind of tell the kind of account you're following, because the ones who are not credentialed healthcare practitioners are the ones who are like, everybody should take zinc. And I'm like, why do we look at your zinc levels and your iron and your copper first?
Right.
Like, before we put you on like 50 milligrams of zinc a day. Like, there's no one supplement regimen or one diet for all people with PCOS.
Right. Right. I was even hearing about B12 shots the other day. And when I hear B12, I think, is your B12 low? Why is your B12 low? What's going on that you are not adequately absorbing? And like, something's going on. I'm not going to just send you to the corner infusion center to get a B12 shot without talking to you about what's going on in your body.
Yeah, so there actually is a connection with B12 with PCOS, in particular metformin, which is the diabetes med that's used off-label in PCOS, and it's usually one of the first things they recommend. It can lead to B12 deficiency. So if you are taking metformin, you should have your B12 levels monitored frequently. But yeah, it's definitely not something where I just recommend it just because.
Right. And I think that's something that's really great for our viewers or listeners to keep in mind, is that anyone who is responsibly giving health advice online is not going to give you those numbers and give you hard, this is what you should do advice when it comes to supplementation, because it really does need to be based on personal levels.
Yeah,
and
absolutely.
It goes for vitamin D also.
Yeah, it's like, what does your diet look like? And I often will test or request a vitamin D level for sure. It's pretty rare I find someone who's not deficient in vitamin D. But your dosing should be based on what your current level is and what your goal is. So again, there's literally, maybe inositol might be the thing I come closest to saying, okay, we try this with almost everyone with PCOS, because that insulin resistance piece is so common. So I do kind of like be a little more proactive on that. And then once we get the test results in, then if it's like, oh, okay, well, you don't have to worry about this so much, but it's a pretty low risk supplement as far as supplements go,
It's true. So how can a woman alleviate her symptoms? That's a big question.
It is a big question. It's by focusing on those root causes. And that's really what I work on in my programs and my course, is like helping you identify what your root causes are, so that you know what your priorities are. You've probably seen those images like floating around on the internet of like, what type of PCOS do you have? Is it insulin or inflammatory or adrenal, or is it post-pill? And I will absolutely 100% tell you, it is very, very, very rare that someone falls into only one of those boxes. It's really maybe like my lean PCOS clients, where they don't have insulin resistance, they don't have inflammation. It really is just that adrenal component. But for most people, it's a combination of the factors. So I always, start with blood sugar balance as the foundation for everything. And I mean, this isn't just women with PCOS. This is like, it's not a bad way to eat for all of us. There's no one who cannot benefit from balancing your blood sugar. And that goes for, someone like me who doesn't have PCOS. I'm sure like if you eat a meal that is just carbs, so like if I go for pancakes for brunch, I love pancakes, but like I know an hour and a half later, my blood sugar is going to crash. I'm going to be sweaty and hangry and in that like, reactive hypoglycemia state. So it's like, okay, well, now when I go get pancakes, I make sure I get my eggs on the side, and I also get a little bowl of fruit so I get some fiber, because that is, it's going to affect how I feel later. And that's just, something we learn. So, I make that foundational for all the women I work with, is that blood sugar balance, and what it ends up being is adding more to your plate so that you have that balance. So it's like, there can be carbs there, like absolutely. Just make sure you've also got protein, fat, and fiber on your plate. And that,
I love that. I love that
yeah.
because it's adding rather than taking away. It's so much easier to add things to your plate than to go the restrictive route.
I find it, most of my clients are very busy women. I work with women who were much like my old lifestyle, which was New York City advertising. I lived out of a suitcase more than, I ordered takeout like 5-6 days a week. So those are the types of women I'm working with who have big, important jobs and are doing things. And, you don't really have time to like meal prep every week. And if you are reliant on something like a meal plan, then what are you going to do when you have to travel for business, or when you get stuck at the office at 8 p.m. and they're ordering dinner in? So using this method, it allows you to, always be able to cobble something together, whether you're in, a restaurant with a client, or you're stuck at work, or you're ordering takeout, or you're traveling. It's not so reliant on the kind of like restrictive advice that tends to add stress to our lives. When you have to look at every menu before you go to a restaurant to be like, is there something that I can eat on this menu? Because you're really able to, put that together however you want it to look.
Right. Okay, so there's balancing the plate, trying to make represent different flavors and different type of macro and micronutrients. And
Yep.
so what's next on the bullet list of how to alleviate symptoms?
Yeah, the anti-inflammatory diet as well. And again, I don't take the approach where it's like, you must avoid dairy, gluten, soy, sugar, blah, blah. Like, I also take the approach of adding. You want to add those anti-inflammatory omega-3 fatty acids, things like salmon and sardines and walnuts and flax. You want to add in those antioxidant packed fruits and vegetables and eat the color of the rainbow. And then you do want to, I never say, eliminate or avoid. I really say try to minimize exposure to inflammatory fats. So like, for example, I live at the beach. I guarantee a fried clam plate will be had at some point this summer. But it's not a regular thing. It's, I don't know what kind of oil they fry it in, but it's certainly not like extra virgin olive oil. So yeah, that's the kind of thing where it's like, okay, this is a treat. It's not a habit, but at home it's like all avocado oil and olive oil. And then, the hormone stuff is where it's really hard. I do get asked a lot, like, what are some foods that help balance hormones? And I really can't tell you if I don't know which hormones are responsible. So for example, like spearmint tea is actually, there's actually some studies on it being able to lower testosterone. But if testosterone is not your problem and your problem is coming from DHEA or high DHT, then spearmint's not going to do anything for you. So that's why, like with the hormone balancing stuff, it's a little harder to kind of make recommendations in a general sense. And we do want to focus on gut health as well with PCOS. That's one that's pretty common. There are some studies that the microbiome in women with PCOS is actually different from women without PCOS. And they actually took fecal samples from women with PCOS and implanted them in mice, and the mice developed polycystic ovaries and irregular cycles, which is like, what, we don't even know what those little buggers are doing for us at this point. So, again, adding in that fiber so that you're feeding your good bacteria, incorporating some of those fermented foods regularly, like yogurt and sauerkraut, to support your gut health. Always use a food first approach before saying, oh, just take a probiotic. Because again, like I use very specific strains of probiotics for very specific conditions. So it's hard to say like what's the best probiotic. It's like, well, what are your symptoms? I don't know.
Right. And I think that's something that's also commonly misunderstood. And I have a probiotic that I love just for general health. But if you are targeting specific symptoms, there are specific species or strains that will target those. And a lot of people see at the store, you go and you buy a bottle of probiotics and it has 1 to 3 strains generally. And that's not what is recommended for general health. It's also not going to help you with targeting symptoms. So it's best to speak to someone one-on-one. There we go again.
Absolutely. So those are really, really the main things I work on from a nutrition perspective. We also, talk about lifestyle factors that can affect all of these things, like sleep especially is really tied to insulin resistance. And it does seem like there is kind of a magical number there, like anything under 6.5 hours really puts you at risk the next day for those cravings and the insulin resistance. So, trying to get in that 7 to 9 hour ballpark of sleep. Exercise, again, that's a really common question I get for PCOS is what kind of exercise I should be doing, or so-and-so says I should only be doing low intensity exercise. And I say it's different for everybody. It depends. It's really like, what does the rest of your lifestyle look like? Are you working a crazy, insane job and trying to do CrossFit 6 times a week? Like that might be a bit much. What's going on with your adrenals? Like, is your cortisol like jacked through the roof? Then like, yeah, you might want to maybe try some yoga instead. So yeah, lifestyle, sleep, stress, exercise, all of that plays into it as well. We talked about the stress component when it comes to worsening PCOS symptoms too. And I don't know if you've been hearing this lately, but I certainly have, that in the last few months, cycles have been wonky for, everyone, not just for PCOS, but it's such a clear illustration of how susceptible our cycles are to stress. And, any changes in routines. I think I had like a 23-day cycle followed by a 33-day cycle. I'm like, where am I? What day is this? I have no, and like I've got stuff pretty buttoned up when it comes to like hormone imbalances. So, yeah, it's really kind of funny to see that immediate impact of the long-term stress of the last few months on what's going on with everyone.
It's interesting. In college, I did a semester abroad, and it was a particularly strenuous program, and it involved a lot of traveling. And there were a good number of students. And I was told ahead of time, you don't even need to pack tampons because everyone stops getting their period. And it was funny because it was actually true. And
wow.
A good percentage of women in this program stopped menstruating for 3.5 months. And it was only stress. It was only the traveling. It was amazing to see that. And it was also interesting to see the amount of pregnancy scares, but it's interesting. And I'm just supporting your point that stress really does impact your cycle. And so at a time right now where, I can't even list everything going on right now in the world, it's going to impact you. And if you're already starting from a place where it was a little bit difficult to predict to begin with, then it's not going to do you any favors. Yeah. So you were you were also mentioning before we started about the incidence of disordered eating and even outright eating disorders within the PCOS community. And I think it's important to bring that up just because the standard advice is lose weight.
Yeah, I think that's playing with fire, to be honest. I've seen anywhere from 3 to 4 times higher incidence of eating disorder and disordered eating in this population, depending on the study cited. mostly binge eating disorder. And the way I kind of explain it, and it's like the fastest way to a binge is to tell yourself you can't have something. I don't know if you've ever had that experience where you do have to avoid a food for a certain amount of time, whether it's fasting or a diet that you chose to go on, and you decide to eliminate this food for a period of time. And then when you finally do allow yourself to have that food again, it's like you go crazy because you don't know when you're going to let your guard down again and let yourself have it. So it's like, I'm just going to eat it all now. I would say the funniest phenomenon I have encountered is that my busiest month is always February. Which makes no sense. You would think like it's when everybody wants to go on a diet in January, or it's like maybe bikini season. Like that's when my busiest season would be. February, my phone is ringing off the hook from women who tried Whole30 or some sort of cleanse or detox in January, and then subsequently spent the first 2 weeks in February eating nothing but gluten, dairy, alcohol, sugar, and they're like finally seeing the light, and they're like, there has to be a different way,
Yeah.
So yeah, I really, if restricted diets are the biggest predictor of ever having an eating disorder, and the rates of eating disorders are so much higher in this population, then I think it's far too risky to even go there, and it's not necessary. And it goes along with the other higher rates of other mental health disorders in this population as well, like lots of depression, anxiety, a lot of body dysmorphia, because unlike other maybe chronic conditions, like if you think of someone with like endometriosis, for example, like you may not see that externally on them. Whereas for someone with PCOS who's struggling with the things like acne and facial hair, like it just, and weight that they're not happy with, like it just leads to that body dysmorphia to begin with.
Right. And that's an endless cycle. And when someone has the advice, lose weight, and whether it's to be more comfortable through symptom management or in order to conceive a child, I can personally speak to the intense biological drive to conceive a child.
Mm-hmm.
And I mean, this isn't a conversation about other methods and other options, but when you have that biological drive, it can really throw you into that desperation, and you're going to keep restricting calories and exercising more and more. And the thing that I really want to get across is that eating disorders come in different shapes and sizes. And we have this idea in society, and even in the medical profession, and even in eating disordered focused medical profession, a lot of times we think of eating disorders and we picture someone who is stereotypically anorexic, someone who is very, very thin. That's not necessarily what we're looking at when we talk about eating disorders. Someone can be big and meet the definition of anorexia. So we need to keep an open mind with that. And we need to, as professionals and as friends and advocates for people we love, we need to know that an eating disorder doesn't come with a specific weight. It can be at any size and any shape and any point in your life.
Absolutely. I think another really important thing to call out, and I know you do work with the prenatal population as well and have experience there, is, especially in that first trimester, baby doesn't need calories. Baby doesn't need extra calories really very much at that point. What they really, really need are the micronutrients. Like we have got to be eating a nutrient-dense diet in that period before pregnancy so that baby has what it needs to develop properly. And I think that's like one of the biggest concerns I have with these fertility clinics who are basically putting all of their patients on something like keto. I think it is possible to, have a more balanced keto diet where you are, maybe a little more flexible, where you are including more of those colorful fruits and vegetables. But that's not really what I see represented on social media. Or if you are eating vegetables, it's like the same 3 low carb vegetables every day. And what we really need is that variety and those colors so that our nutrient stores are where they need to be when we do get pregnant. So it's always why, I especially argue against the use of a restrictive weight loss diet or, something that's cutting out whole food groups in that preconception period. I think it's really dangerous.
Right. And a modified ketogenic diet is not a ketogenic diet because you're not putting your body into ketosis, which to me is a good thing because you don't want your body to be in ketosis. I was talking to a client who was saying that that even an apple could take her out of ketosis, so she couldn't sit down and enjoy apples with her kids, which had been a thing for them. And the kids were asking her about it. And she was telling me, but if I have an apple, I'm not maintaining my ketogenic diet. And I said, but that's how badly your body doesn't want to be on a ketogenic diet, that one bite of something could throw you off. And that's how we know that's not how we're supposed to be eating.
Yeah, I always talk about the fact that PCOS is a chronic condition, meaning, you have it for your whole lifetime. And so any changes that you're considering making in your diet or lifestyle, you have to be able to sustain for a lifetime. And I think that's why taking the approach where it's like, okay, well, we can always add things to make this better. I'm not saying don't have the birthday cake or don't have the pizza. I'm saying, maybe have the pizza and then look at it and be like, okay, what's it got? It's got carbs, it's got protein. What's it missing? So it's really missing, fiber, and that's basically it. So, have a side salad with your pizza, and it's like, then you check off all the boxes. So that's really the approach that I take, because I think it's unrealistic to say to someone, you have PCOS, you should never eat a carb again or never eat sugar again. And, I don't know what guidelines you use for sugar, but I tend to go by the WHO guidelines, which, they say up to 5% of daily calories from added sugars is probably fine. And I think that's a really reasonable amount. Like if we're talking about a 2,000 calorie a day diet, and again, I never count, I never make people count. I have far better things to do with my life than count. But being able to take that 5% of, say, a 2,000 calorie a day diet and come up with, oh, I have 25 grams of added sugars a day. So that can kind of help you ballpark it. And no, fruit does not count as an added sugar. Fruit is natural sugar. Like, eat all the fruit. Fruit is fine. I never met anyone who became overweight from eating too many bananas,
or avocados for that matter.
It's just not a thing. But
really
there's added sugars that sneak in. That's where it's like, okay, well, if I get a budget of 25-ish a day, I can go have my dark chocolate peanut butter cup after lunch, or I guarantee my husband 2-3 nights a week is going to be like, do we have ice cream? So it's and I don't sweat the kind of things like, oh, that tomato sauce has 3 grams of sugar in it. I don't even sweat that kind of stuff, but it does make you think twice about, the Starbucks drinks that are what are they, 108 grams of added sugar per thing. It's okay, well, I can have that, but that's my budget for 4 days, basically. So that's kind of how I personally would rather eat the ice cream. That's just, so that's how I approach the sugar, because, you really can't deny that the insulin resistance piece of PCOS is extremely strong, but you don't have to just eliminate sugar from your life forever. At all.
Especially because the elimination of sugar will in the end result in more sugar consumption as you commit and rebound and commit and rebound. And you might say, well, this time it's really for real, but it's not, because that's not how our bodies work. That's not how our minds work. And I'm a big advocate of looking at this from a holistic perspective, which obviously you're doing as well, Melissa. And we can't just say food is fuel and it's function and it makes our bodies run. There's a very, very, very small percentage of people who see food that way. Like, actually, they organically see food that way, and that's fine for them. But for the rest of us who see food as connection and culture and experience, especially right now, especially when we're really looking for that connection, we can't place arbitrary rules on ourselves because they will backfire. And we need to
Mhm.
avoid more stressful situations. We need to work on managing the stress we already are facing right now. And by saying, I'm not having any added sugars, it's, you know, that it's not sustainable. You know that it has never worked before. There's no indication it will work this time. And there are other ways to go about it.
I always tell people that I would rather they eat cookies and feel fan freaking tastic than eat kale and cry. Like, you know, yeah, we do. We get so much enjoyment out of food, and it's part of our lives, and it is that connection with our ancestors and you know, our loved ones, to share that moment of food, like the ice cream with my husband. Like, that's what, you know, what we do. You know, and I think back about things like my grandmother's totally GMO corn syrup filled, chocolate, gluten filled pecan pie that was just like, you know, a sugar bomb. And it's like what I wouldn't give to have one more bite of that pie. You know, it's
Yeah.
like food, and to just, you know, have to deny yourself those kind of connections when events and holidays and family traditions come up. It's not realistic, and it's really kind of sad.
Yeah. Yeah. For years, I was trying to replicate my great grandmother's recipe for blintz casserole, which is basically blintzes stacked on top of each other, and then with like this
Cheese,
sour
cheese.
cream. You know, I always thought she made it from scratch. She did not. She made it from those freezer blintzes, and it was delicious. And I think I finally got the recipe. But the thing is, this is our how we connect with each other, how we remember interactions with relatives who aren't around anymore.
Mm-hmm.
Well, I did a whole one on that, a culture of quarantine and how we're using food to connect. So people can watch or listen to that one.
Cool.
We've been going for almost an hour now, which is way longer
I
than my
know.
usual nap time nutrition. So, what's something that we haven't mentioned that you really want people to know, or have we hit everything?
Trying to make sure. So I would say, you know, I'm always trying to remind people to be cautious of where they get their information. There are a lot of, you know, influencers and, you know, quote unquote PCOS coaches out there who are putting out information. And I want you to think about why it's problematic to follow the advice of someone who says, well, this worked for me. You know, me, and by worked, they mean I got pregnant or I lost weight, and this worked for me. So remember that every single case of PCOS is different. So what your symptoms are different from your friend's symptoms, are different from, you know, that other person's symptoms. And for the same reason, the same approach doesn't work for all people. So, you know, especially when it comes to following people who, you know, there's those like beautiful blonde model types who like have babies and now they sell PCOS supplements and things like that. Just remember, you are different from that person, and what worked for her may not work for you. And, you know, it really is important to get to the root causes of what's going on for you. And I do want to end with also, like, it doesn't have to be so hard. I see so many, one of my clients gave me a list that came from a Facebook group for PCOS with a list of foods to avoid for PCOS. And it was just like, there's no rhyme or reason to, I mean, obviously anything delicious was on the list, but, you know, it also had things on there like salad dressing and like canned tuna. And I'm like, tuna, like that's a fantastic source of protein, and really handy and accessible. So it does not have to be so hard. Like, I literally cut out 0 foods with any of my patients, and they still get pregnant, improve their symptoms. Some of them do lose weight. You know, we don't focus on that. What usually ends up happening is they'll go for their doctor's appointment, and the doctor's like, "Oh, you're down 15 pounds since last year," and you know what? Like, that's the kind of weight that stays. You know, you're sort of like reaching a new set point at that point, slowly and gradually. You know, doesn't always happen for some people. It happens. So we get these results without cutting any foods at all. You know, and I think also, like, being conscious. I think this is a good time in history to talk about being culturally conscious as well, and that's something I do try to do with my clients. You know, and if your diet doesn't look like the white influencer diet that's like shown on Instagram all the time with the, you know, brown rice and the kale and the wild organic salmon, like, it's okay. Like, you can still make a balanced meal using the vegetables you're used to, or the fruits you're used to, or the carbohydrate sources you're used to, you know, and just sort of like follow that plate method using your foods that you enjoy, because you're not going to stick to a diet that you don't enjoy either.
Right. Right.
You know,
And that's the same with
not sustainable.
exercising. Right.
Mm-hmm.
And that's the same with exercising. If you are pushing yourself and torturing yourself on the treadmill every day, might as well find something you actually enjoy and something that you're not going to dread doing. And, you know, on the flip side, if you really enjoy the treadmill, go for it.
Yeah, I always tell people they get bonus points for anything that was done outside or something that has like a component of joy. Like, one of my
Yeah.
clients recently was taking like a drum aerobics class, and it looked like the most fun thing ever. It's like, oh, that's really fun.
I would totally do that. I would definitely do that.
Yeah, absolutely.
Yeah. Okay. So I mentioned at the beginning that you have a course online for PCOS,
Mhm.
and so that's for people who are dealing with PCOS right now.
Yes. So it's the same materials that I use with my one-on-one clients in my 3-month programs. I've translated to a 6-week self-study program, and we're actually kicking off again July 6th. So next week you will start to see how to sign up for that course. You can find it on my website at directly at avocadogrovenutrition.com/PCOS-course, or you could just go to my Instagram profile, which is the.hormone.dietitian, and there's a link to the course waitlist right there in my profile. I'm also doing a free webinar next week, which is PCOS period success. 3 easy steps you can take now to get your periods back. So that'll be really fun. It's an hour. I'm doing 3 dates next week. I'm doing Tuesday, Thursday, and Saturday. So hopefully you'll be able to find a time that works for you. And it will be recorded. So if you can't make it live, you can catch the replay, but you do have to sign up in order to get the replay. And I have a new book coming out too, which I should mention. My book,
Yeah.
it's actually called A Balanced Approach to PCOS. And, you know, it really is built on that principle of the balanced plates. And it's 16 weeks of recipes, and it kind of goes through the seasons. So there's all kind of different ones. And that's being released August 25th, but it is available for pre-order now.
Amazing. That's very cool. And so is that pre-order on Amazon?
Amazon, Barnes and Noble, I think. Yeah.
Okay.
Yeah. And so if they want it, and I didn't realize this. Did you know they honor whatever the lowest price is? So if you pre-order something and for whatever reason it goes on sale before the release date, or they decide to change their mind about the pricing, they will honor the lowest price for you. So there's like no risk.
Oh, interesting.
Yeah,
Wow.
I had no idea. I know.
That's really great. Okay, so you have a lot going on, and you also do one-to-one counseling, but according to your website, you've got a wait list going for that.
I do. I have quite a wait. It's about anywhere from 2 to 4 months, depending on what's going on. So yeah,
Okay.
unfortunately. But the course is a really good option to work with me. You kind of get some of those answers for yourself. And the book will be another way to, a much lower cost point to um, find out more about my approach. And I do have some articles on my website as well that kind of go over like what we talked about, like how to plan meals and things like that when you do have PCOS.
Good. And that's avocadogrovesnutrition.com. Good.
Yes, after July, it will be thehormonedietitian.com. Finally making the URL switch, but that will happen in July. So
Great. Well, that's good. That's good to mention because as a podcast, people might listen to this at different times than this video. Okay. So we will end it there. Thank you so much, Melissa, for joining me. This was great. And if you viewers or listeners would like to support the work I do to provide low cost or free resources, I'm on patreon.com /naptimenutrition. You can find me on Instagram at toddler.testkitchen and Facebook at Toddler Test Kitchen AZ and Baby Bloom Nutrition. And theoretically, I'm here every Tuesday at 1:15 p.m., but that has not been sustainable during the lockdown. So I'm here whenever I can be, but you can always bet that I will post a video on Tuesday at 1:15. It's generally going to be a throwback right now. And I do have a new podcast coming out every Sunday at 10 a.m. Arizona time on iTunes, Stitcher, Spotify, and iHeartRadio. So thank you so much again, Melissa, for joining me to talk about PCOS.
thank you. It was nice catching up with you again. It's been a while.
Yes, it has been a while. So, thank you so much. This was wonderful.